Okay, so here is another mold, and this is a tiny little baby mold. We don't have any venting here as well, but what you'll notice is that the canal portion of this mold is way too small for the sizing of the tube. So for anyone who has a tiny baby, again, teachers of the deaf, if you have little babies and you need to retube their molds, you have to be careful about trying to pull the tube through here when this is not big enough for the tube. And so this tube actually stops about halfway. If I pull it out, you'll see it only went in part of the way. And so you do need to be mindful of that when you're retubing molds for smaller children, and then also if it's necessary to glue the tubing in so that it's not so easy to pull out that halfway mark. So for this one, you'll want to be very gentle about how you feed the tubing through and making sure that you're not going to potentially tear the mold, because then you'll need a visit to your audiologist. So you'll notice I'm trying to push the tubing in and it's having a hard time at the canal portion, but I do have a little bit sticking out. So as a right-handed person, I'm going to move to my left hand so I can see if I can pull this through gently and slowly. And in this case, there is not any space for a tube lock or an Invisalign of any kind. It has to be a standard tube. And I'm going to start twisting my tube because you can see it's not quite upright. It should be above here for this left ear mold. So I'm going to just twist the tubing to try and make sure I'm pulling it at the right angle. And then there, it hit the spot where it sits up well. So for this one, because you don't want to make the canal thicker, you do want to pull through an extra few millimeters, trim it, and then pull it back to fit into this spot where it's upright. So I'm going to do that next. I'm going to pull through again just a few extra millimeters so that when I trim it, it will recede back inside. And I'm going to hold the tubing, put a little bit of stretch on it, make the snip, and then pull my tubing out to where it sits upright. And then if you have the old tubing, you can trim it, or you can put the mold in the baby's ear, mark where a pen where it needs to be cut, and then take a trim. And there's your new sweet baby mold.